According to a study conducted by Université Laval in 2011, 40% of adult Canadians are affected by sleep disorders. There are many sleep disorders, but today I'm going to be talking about insomnia, sleep apnea, as well as narcolepsy and restless legs syndrome. Let's begin with insomnia. Insomnia is a disorder that makes it hard to fall asleep, that makes it hard to sleep for a whole night without waking up, or that makes you wake up early without being able to fall back asleep. Apart from that, there are more symptoms such as not feeling well rested in the morning, being tired during the day, having a lack of focus, as well as being irritable, having depression and or anxiety. The causes of insomnia may vary from person to person, but the most common ones are stress, having a work schedule that disrupts the circadian rhythms, poor sleep habits, such as going to sleep at irregular times, watching a screen before bed, taking long naps during the day, etc., and eating too much before bedtime. Sometimes insomnia is not the primary problem, and it's caused by another condition, such as a mental health disorder. Everybody can suffer from insomnia, but some people have more risk of being affected than others. The risk of insomnia is greater if you're a woman, over the age of 60, you don't have a regular schedule, you have a mental health issue, you have a physical health condition, and you experience a lot of stress. As you can see in this graph, women are way more at risk of having insomnia than men, and the older you get, the more at risk you are of being affected by the disorder. Fortunately, there are ways to prevent having insomnia. First of all, reducing the length or the amount of nap taken during the day can improve your sleep during the night. Also, avoiding caffeinated drinks and create a bedtime ritual can greatly improve the quality of sleep. Let's continue with sleep apnea. It's a very serious sleep disorder in which a person who suffers from it stops breathing from 5 to 100 times per hour. There are 3 types of sleep apnea. The first one is central sleep apnea, which happens when the brain doesn't tell the respiratory muscles to do their job. The second one is called obstructive sleep apnea, and it happens when the muscles in the throat relax too much. This is the most common type of sleep apnea. And the third type is complex sleep apnea syndrome, and it happens when the person has both central and obstructive sleep apnea. Symptoms of sleep apnea may include snoring, gasping for air during sleep, having headaches in the morning, waking up to a dry mouth, insomnia, and many more. The causes of sleep apnea are different for a central and an obstructive type. For central, the brain simply doesn't send signals to the respiratory muscles, which results in a lack of breathing for a short period of time. For obstructive sleep apnea, the cause is that the muscles at the back of the throat relax too much, so the airway closes up and air can't get through. That lowers the amount of oxygen that is in the blood, which makes the person affected wake up. Some people have a higher risk of being affected than others. Males, older people, and smokers are more at risk of having sleep apnea, as well as overweight people, alcoholics, and people who have narrow airway. Sleep apnea can cause fatigue during the day, type 2 diabetes, liver problems, metabolic syndrome, high blood pressure, and heart problems. There are solutions to cure sleep apnea. For an obese person, losing weight can greatly improve the quality of sleep. There are also machines called CPAP or other airway pressure machines, and even oral appliances that can help obstructive sleep apnea. If all of these don't work, surgery is also an option. Now, let's talk about narcolepsy. This is a sleep disorder that causes extreme drowsiness during the day, as well as sudden attacks of sleep that can last from a few minutes to half an hour. People with narcolepsy often find it hard to stay awake throughout the day. This can be very dangerous because a person can fall asleep while driving or crossing a road. Some people who have narcolepsy can also have cataplexy, which is when muscles suddenly give without warning. People who experience that have type 2 narcolepsy. Symptoms of narcolepsy include daytime sleepiness, sleep paralysis, change in REM sleep, which is rapid eye movement sleep, hallucinations, as well as cataplexy, which is triggered by an intense emotion. Hallucinations are called hypnagogic hallucinations when they happen as the person falls asleep, and hypnopompic hallucinations when they happen as the person wakes up. It's not rare for a person who suffers from narcolepsy to also suffer from other sleep disorders, such as obstructive sleep apnea, insomnia, or even restless legs syndrome, which we're going to be talking about in a minute. For years, scientists have been trying to pinpoint the cause of narcolepsy without much success. All we know is that people who suffer from the disorder have low levels of hypocretin, which is a chemical that helps to regulate sleep. Genetics can also play a role in narcolepsy, but the chances of passing on the disorder to children are very low, at only 1%. Some people are more at risk of having narcolepsy than others. For example, people who have family history of narcolepsy are more at risk, as well as people who are between the ages of 10 and 30, which is usually the age range where narcolepsy begins. Unfortunately, there are no known cures for narcolepsy, but support from the sufferer's social circle can help coping with the disorder. There is medication available to people who have narcolepsy, but it doesn't cure the disorder completely. Finally, I'm going to be talking about restless legs syndrome, also known as Willis-Ekbom disease, or RLS. This condition causes a patient to have an uncontrollable urge to move their legs as they're trying to sleep. Symptoms of RLS are twitching of the legs during nighttime, sensation in the legs that gives the person the urge to move them, a relief once they move their legs. Usually, the symptoms get worse as the night progresses. The sensations are described as something crawling, pulling, throbbing, or itching inside the legs. It can also feel like electric shocks. There are two things that can cause RLS. First of all, it's an imbalance of dopamine in the brain. It can be caused by heredity and pregnancy. During pregnancy, many hormonal changes occur, which is why sometimes restless leg syndrome can worsen. The disorder is more common in women than men, and older people have a higher risk of developing it, though it can develop in childhood as well. Restless leg disorder is often accompanied by other medical problems, such as a peripheral neuropathy, which damages the nerves in the hands and the feet. It can also be accompanied by iron deficiency, kidney failure, or spinal cord conditions. Damage to the spinal cord can cause RLS as well. People with RLS find it difficult to fall asleep or to stay asleep because of the feeling in their legs and the constant movement of their legs keeping them awake. Today we talked about 4 of the most common sleep disorders, which are insomnia, sleep apnea, narcolepsy, and restless legs syndrome. But there are many more. Thank you for taking the time to listen to my presentation, and please stay safe out there.